Hello again, everyone. Um, I have Dr. Opoku with me, and we'll be talking about the clinical outcomes of intensive cardiac rehab and traditional cardiac rehab. This is a continuation of the study that we did last year and we presented, and this year we have built on it and found out, and we had a larger population size, so we wanted to talk about what we saw. Clinical context. The cardiac rehab is a medically supervised program designed to improve cardiovascular health in individuals recovering from major cardiac events. Traditionally, cardiac rehab is it is actually has to come from a cardiologist. It is prescribed, I would say, to anybody who has a major cardiac event, and it is focused on improving cardiovascular health and overall outcome. In the United States, 49% of adults have some form of cardiovascular disease, uh, and it is a class one recommendation from ACC and AHA for cardiac rehab post a cardiac event. So anybody who has a cardiac event, class one recommendation is that they have to have cardiac rehab. Unfortunately, only 20 to 30% of eligible patients actually attend cardiac rehab, which is a significant underutilization of it. In the recent years, the new cardiac rehab called intensive cardiac rehab uh, came out and has is now being implemented, and our institution recently started implementing it to transition patients from traditional to intensive, and we looked at that specific time to see what the difference and how patients benefited with traditional and what the difference was with the intensive cardiac rehab. Briefly going over the differences between the traditional and the intensive, the main major ones that we want to focus on are the number of sessions. So traditional cardiac rehab is about 36 exercise sessions, while intensive cardiac rehab is 72 sessions. The traditional has supervised exercise training, but with the intensive training program, we have Pritkin lifestyle education. Now, Pritkin is a dietary program. Which basically tells the patients how to change their diet and integrate it into their day to day lifestyle. Uh, and it also integrates 36 nutrition and cooking education sessions. So not only just what to eat and what not to eat, but also how to how to make a meal out of the recommended food products. Remainder of it is largely the same, but this was the major difference between the two rehabilitation programs is the number of sessions and the integration of um, the Pritkin dietary modification. Our study objective was to compare outcomes between traditional cardiac rehab and the Pritkin intensive cardiac rehab program at Augusta Health by evaluating the changes in functional capacity measured in METs, mental health measured with PHQ-9, quality of life, blood pressure, weight, and lifestyle adherence. The interesting part of this is Rate Your Plate because it has integrated 36 educational sessions about food and how to cook your food and what to integrate in your food. We conducted a survey to ask the patients integrated in it how they rated their plate from before versus after the rehab. Our population included 202 patients, out of which 86 were enrolled in intensive cardiac rehab, whereas 116 were enrolled in traditional cardiac rehab. Now, mind you, we were in the process of transitioning people from traditional to intensive, which is why there was a little bit of difference between the number of patients enrolled in each. And at the end of the program, we surveyed 48 patients. This was done between 2025 and 2026 at Augusta Health Cardiac Rehab Center. We validated this we had a dietary tool, a rate your plate dietary tool, which we compared between the two groups. A PHQ-9 depression screening was compared between the two groups, quality of life and um, the survey. We assessed the exercise capacity in METs, dietary behavior, depression, blood pressure, quality of life, and in terms of analysis, we did a pre and post comparisons. We compared it with Cohen's D effect size, which measures the the change or the how much change occurred between the two and after, and statistical significance with p-value. Uh, yeah, and I'll hand it over to Dr. Opoku to talk about the results.
So we'll start off with what qualified these patients for cardiac rehab. So our patient population, majority of them came post stent PCI, about 46%. Um, the other group was after a valvular procedure, about 20%, and cabbage was next, and also NSTEMI. Then we had a few from CHF, uh, congestive heart failure, then stable angina and PAD. So you can see the majority of them was after a stent. That's actually an order set. So the interventional cardiologist, after the stent is placed, just automatically refers them to cardiac rehab. So looking at the results, first I'll point you out to the major change, which is the ratio plate, which confirms why the intensive cardiac rehab is much better because of the intensive Pritikin diet, which attests to like plant-based lifestyle. It had the most statistical significance with its p-value less than yep, at 0.018. It also had the greatest effect size at 0.74. And obviously, if you're eating well, you should also be losing weight, right? So if you look at the weight loss, comparing ICR at an average weight loss of 3.6 compared to zero point 0.2 for TCR. In all the other domains, there were some similarity between all of them, but most of them favored ICR compared to TCR. So for like exercise capacity, ICR had a better change. For blood pressure, ICR as well, well with the exception of diastolic. For depression, ICR was much favored compared to TCR. So this is just a bar graph, and you can appreciate. So this is a bar graph, so you can appreciate the changes. So this will be ICR compared to TCR, with the major change at 8.5 and it being the only statistical significance. And then looking down at weight loss, we have a greater change with ICR compared to TCR. And then with METs, similar changes, PHQ, similar changes. So with quality of life and blood pressure. So with the survey, we wanted to find out, okay, these patients are going through this program. What do they think about, what's going on? How are they facing the changes? How are they, you know, changing their food that they're putting on their tables? And also, how are their lifestyles changing? The major, I guess, something to take a look. All patients, 100% from TCR and ICR, would recommend the program that they went through. And also, as we can see, the quality of life, lifestyle, and activity, um, all the patients rated it ICR better than TCR. So that also attests to the 36 additional sessions for the Pritikin lifestyle diet. Mm. So we've talked about all this statistical difference. What does it mean to the patient? What is the clinical translation for the patient? So as we discussed, rate your plate. So rate your plate is a validated tool by the ACC, American College, American Cardiology College, that pretty much asks the patient, what is the amount of saturated fat diet that you're eating? What is the amount of diet? Or what is the amount of sugar that you're putting in your food, salt? And with ICR, they had a better change compared to TCR. And if you're eating better, you should be losing weight. And with weight loss, you should be, it also helps with decrease of heart failure exacerbation, also helps with blood pressure. So again, ICR had the better change with blood pressure. And with that, which each 10 milligrams, with each 10 points of blood pressure that you reduce, that translates to 28% uh, reduction in cardiovascular events. And so these are exercise capacity. In ICR, they had a much better exercise capacity, which translates. So with each increase in MET, that translates to a 13 to 25 reduction in mortality. Of note, for PHQ, they were somewhat similar between the two. They were both able to reduce the PHQ down to 2. With that, that supports better medication adherence, willingness to exercise, and it's a long-term risk factor control reduction. And with quality of life, they're somewhat about the same. TCR came up a little bit better, but also with that, reduce hospitalization and better long-term self-management. So, discussion, both um, cardiac rehab is better than no rehab at all. But if you had to choose between the traditional cardiac rehab and the intensive cardiac rehab will give you much more benefits compared to traditional. And as we discussed with the additional 36 sessions, you have a better um, diet, which translates to weight loss, translating to better blood pressure and also better cardiometabolic outcome. Maybe some of the limitations of our study, it was done at Augusta Health. We did not account for any other centers, and it was non-randomized, mainly because it's insurance driven. And so our conclusion, both ICR and TCR do produce some clinical meaningfulness and improvement in exercise capacity, blood pressure, depression, and quality of life. But ICR gives us a much better improvement when you had it compared to both. Maybe something that we can consider in the future is the referral rates, standardizing it so then we can have more patients that could benefit from cardio. And special thanks to the rehab team and the nursing staff and the patients. And then these are references. Any questions? Okay.